Here's a positioning possibility for McKenzie technique. And to achieve first level McKenzie with the back in extension, I'm going to take this pelvic support, turn it around, and combine it in positioning with the leg support. And this will give a declining aspect to the thighs of my patient. So for McKenzie with your patient, your client on the body cushion in this way, we've established some extension. And this is going to allow your client or patient to relax and maximize the effectiveness of that first level McKenzie, if you will, or extension. Other involvements using this position are carried forward in the video presentation on new approaches to muscle therapy, and so I would suggest that you reference that for the whole treatment regimen and protocol using the body cushion in this way. I want to give you some great ideas about how useful these long rectangles can be and why that works really well for fine-tuning the positioning. First of all, the density of foam in the long rectangle is a lighter density than is the foam in the small wedge and the larger wedges. So what this allows you to do is, by increment, fine-tune to a lesser degree. One way the long rectangle can effectively come into play is in a situation where you have a client or a patient with a smaller rib cage. In that case, when they're face up, they may feel as if they're slipping into that ventral space under their back. To compensate for that and fill that ventral space, you're going to use a long rectangle. And to do that, it's very easily applied simply by, if you're using a sheet, just slips right under the sheet and it pops right into that hole, and it will conform to the shape and size of that opening. And that's going to afford more support under the spine. Of course, if you're going to be working for a while under the back in that space, you're not going to have that there. But for the time they're going to be face up where you're working other parts of the body, it's really important that they're well supported. Another way that you can apply the long rectangle, and again, because it has greater compression or less resistance, and you want to tune up maybe the positioning for the hips, and you always check in and ask of your client, your patient, how it is that they're feeling. And if they're feeling any pressure in the low back, in the hips, if they are, you might try this. Take a long rectangle, have them lift up slightly, and I'm just going to slide that right underneath. And that sometimes, that small consideration of change in positioning can result in a large experiential difference for your client or patient. Another way the long rectangle can effectively come into play is in a situation where your subject, usually a female, has a broader breadth of hip than of the rib cage. And in that case, what happens when they get into the lateral posture is that it induces some lateral flexion in the lumbar spine. So to eliminate that, what we're going to do, and what we've done here, is we're going to place the long rectangle right underneath the body cushion so that we have it placed between the rim of the ilium and the lower portion of the ribs along the lateral aspect underneath. And that will help to correct any lateral flexion that otherwise your client or patient will be experiencing. When working on the floor, the armrest can come into play in a really effective way. In this case, I'm going to have the armrests alongside my subject. Otherwise, you can use the large wedges as I have here, just as you would on the table. But in this case, I can place the client's arm straight out and very effectively have a way to work and in this case apply pressure very effectively with the client's arm very well supported. In the basic application video, you saw a way of using the body cushion using a chair and a table. And so I want to share a couple other ways that you can utilize the body cushion in a seated posture. If all you have is a folding chair and you don't have a table, you can have your client, your subject, straddle the folding chair facing the chair back. Simply place the folded three parts of the body cushion, being the chest, pelvic, and face supports, right on their lap with the chest support against the chest. And I'm just taking the face support, putting it up on top. Your face is in the face rest, and she'll just have her arms, just allow your arms to hang freely. There you go. And this kind of predisposes very well the upper shoulders, the trapezius. And with her feet ahead of her knees, she's got very stable positioning. And voila, you've turned a folding chair into a massage chair. Another possibility for using the bodyCushion in a seated posture is simply to have your guest sit in a chair as they normally would. But Rochelle, I'm going to have you move up a little bit so you're more toward the front end of the chair. That's good. And your feet about a foot apart. And we'll make sure that the feet are ahead of the knees. I'm going to place the bodyCushion on your lap, and we'll have the face support up here on top, your face in the face rest. Let's have your arms over the top now, and just take a nice deep breath. And as you do, I'm just going to let you go forward as you exhale. Okay? There. And so we're allowing this positioning that lengthens the spine. How's that feel?
That feels great.
Good. So try these positioning possibilities. They can be put to very good advantage with your clients and patients. Now that you've seen a variety of different positioning possibilities using the bodyCushion, I suggest you can take it to an even higher level. And to do that, you'll want to take a look at the video series called New Approaches to Muscle Therapy. There are over 72 different positioning techniques that are explored in detail so that you can, using the index time-coded reference of these videos, go to these different techniques and look at ways that you can elevate the good work you're already doing to a higher level. So have fun using your bodyCushion. I know you're going to enjoy using it. And I know your clients, patients, and athletes are going to enjoy it as well.